Mahalaga ayon sa World Health Organization na mabakunahan muna ang medical frontliners sa bansa bago ang ibang sektor, lalo na ngayong patuloy ang pagtaas ng bilang ng kaso ng pagkakahawa-hawa ng COVID-19. Ayon kay World Health Organization Country Representative Dr. Rabi Abayasing, ngayong nakakaranas ng hirap sa pagbili ng mga bakuna, kailangan number one priority sa mga bakuna na sa bansa sa ngayon ang mga medical frontliners.
What we are currently experiencing, however, is because of the difficulty in accessing vaccines. We need to still prioritize and ensure full coverage of the frontline healthcare workers. Right now, we are happy to note that the Philippines has provided vaccinations for almost 1.25 million people. Of that, nearly 63% of the frontline workers have been protected. So we're still short of protecting all the frontline healthcare workers, and the current surge demonstrates that we need to have healthcare workers fully protected so that they can work to care for the sick and help them heal. So we continue to emphasize that let's work on a priority basis to protect the frontline healthcare workers.
Sinabi din ng opisyal na mabuti na natutukoy na ang mga prioridad sa bakuna. At anya, tama lang na mapabilang essential workers sa A4 category, kasama na dito ang mga guro.
It is an important element in the vaccine response. They are certainly envisaged to be covered in the WHO's prioritization groupings. WHO agrees to these groups, but following the prioritization is important to maximize the impact of the vaccination as an additional tool in the entire COVID response.
Sa pag-amin pa nito, napakahirap ngayon na makakuha ng mga bakuna. Sinabi nito na posible na ngayong buwan at sa susunod na buwan ay may makukuha ang Pilipinas na COVID-19 vaccines mula sa COVAX facility.
Unfortunately, I cannot confirm dates, but we are expecting a consignment within this month. So we believe that we will receive some stock of vaccine within this month, and also some vaccines next month. So we are optimistic that we will continue to deliver on our commitments to the Philippines through the COVAX facility.
Sinabi din na opisyal na tinutuligsa nila ang hindi pantay na distribusyon ng mga bakuna, lalo na ang mga mayayamang bansa na nagagawa pang makapag-imbak ng COVID-19 vaccines na tinatawag nilang immoral.
Our Director General early on identified this as a global moral failure that we are not distributing vaccines equitably to protect the most vulnerable and at-risk populations. And this is precisely why 1 year ago WHO conceptualized with key partners the setting up of the COVAX facility. We continue to see that the majority of vaccines are being procured by high-income countries, while there is significant impact of the pandemic affecting frontline health workers and elderly people in many of the least developed countries and middle-income countries. So we continue to urge countries to share vaccines and make available all technology and share technology so that other countries can also join in increasing the production capacity of vaccines so that the vaccine distribution can be done more equitably and more quickly.
Ngayong hirap pang Pilipinas na makakuha ng mga kinakailangang bakuna. Sinabi ni Abayasing na napakahalaga ang pagsunod sa ipinatutupad na minimum health protocols para maiwasan ang pagkakahawa ng nakakamatay na sakit.
We still emphasize that we can significantly reduce transmissions by properly implementing the minimum public health standards and the non-pharmaceutical interventions while we wait and while we work towards making vaccines widely accessible. So I think we need to recognize the realities. We have been fortunate that we have vaccines that were developed within 1 year of the pandemic. This is indeed unprecedented success. And as we make them more accessible for all countries, we can still do a lot by ensuring that we practice the protocols that have shown that we can suppress transmission.
Janice Cosio, Radyo Inquirer Online, bayan nagtatanong, mamamayan nag-uusisa.